நண்பர்களே. Friends, today we have Comrade Kavitha Krishnan with us. Kavitha Krishnan is the Secretary for All India Progressive Women's Association, which is popularly known as AIPWA. And also she is a Politburo Member of Communist Party of India, Marxist-Leninist CPIML. And recently she has been sharing her views against so many issues connecting with COVID death and COVID management and all. So today we are going to have the discussion on the whole issues connected with COVID and the present politics in India. Welcome, madam. Thank you very much for giving your valuable time to our studio.
Thank you. Just call me Kavitha. Yeah. Thank you. Yeah.
Actually, when I see the data in the internet and other government websites, it says that around 4 lakhs people have died so far. To be precise, 3,93,338 today's count of death. Right. So, but people like you are claiming that the real number would be 10 times more than what it is. And why do you make this claim? How can you arrive at this kind of conclusion?
See, one thing is there are several ways of doing this. One is, of course, even our own eyes are telling us that, if UP is saying that their number of deaths is just a few thousands, but if you look around, their rivers are full of dead bodies. Ganga is full of dead bodies. Ganga's banks are having bodies buried on, all of that. So and you are having overflowing crematoriums. Crematorium workers are saying we are working 24/7. So those are a common person also can see that your eyes are telling you something different. The other thing is to basically something which journalists have started doing. The first person was a data journalist called Rukmini S. Yes. So she is a very excellent data journalist, and she has been pursuing, covering the pandemic very, very sensibly right from the beginning, since last year. So what she suggested was that one of the ways in which to look at actual death rates, which other people in other countries are also doing, is to compare the deaths of this year with the deaths in the same months of last year. How do you do that? Because the official data you are being given about COVID deaths is something. So she's saying, don't look at COVID deaths, just look at total mortality. Okay. And the way to look at that is to look at the civil registration. Because the civil registration of births and deaths is done. This is not, this is not done only through hospitals, and you don't have to have a COVID certificate and all. It is generally a civil registration of death. Okay, so if you look at those numbers, and keep in mind that in India those numbers are also every year they are undercounted, because not all deaths are registered, not all births are registered. So naturally those numbers are also not perfectly accurate. You should assume that around 15 to 20%, actually you're falling short. But even then, if you look at it, then the births and the deaths of months between January and say May in 2021, if you compare it with 2019, pre-pandemic, even if you compare it with 2020, and certainly if you compare it with 2018, the numbers are starkly several times, they are several times the actual, the old number. Okay. So if you're having deaths that are basically 5 times the number of last time, okay, or 6 times the number of the last few years, then something is clearly wrong. Okay. You need not assume that all the excess deaths are COVID deaths. But you should assume that these are deaths that have happened in a somewhat abnormal situation. What is that situation? Many of them could be, of course, COVID deaths, but also several of the deaths could be deaths from other causes, from people who even as something as simple as diarrhea. I'm telling you about a girl I found out about just in the last couple of days. It's a sanitation worker in Delhi, but during the first lockdown, which was a very strict lockdown. At that time, last year, that was in the first wave, she got diarrhea, gastroenteritis and diarrhea. And she could not get the treatment because the hospitals were not admitting patients who were not having COVID certificates, and COVID testing was impossible to get. And so she died of diarrhea, something of which she should not have died. She should have lived. She was a young, healthy woman. She should have lived. Similarly, somebody with a heart condition, somebody with a
Yes,
heart
yes.
emergency, somebody with dialysis who is not able to get dialysis. These are deaths that are happening due to a situation of overflow in hospitals, hospitals not being able to spare room and offer safe spaces to non-COVID patients. Okay. All these deaths, you can say, are caused either by COVID or by COVID mismanagement, right? So mismanagement meaning I'm not blaming just the hospitals. I'm not blaming the hospitals. I'm saying that it is our health system that has caused these deaths, right? So clearly you are having excess deaths on these rates, and these numbers are some in several states, like especially states like Bihar, UP, Andhra Pradesh, even, and of course, states like Madhya Pradesh. In these states, you are having these deaths being around 34 to 40% the number being given out by the government. That's one.
Okay.
The other thing is that even if you assume that these are somewhat undercounted and you budget for a little bit more, basically what people are saying is that even at a conservative estimate, you are probably at least 16 lakh people must have died of COVID.
Okay.
And
Okay.
at a more probable estimate, probably around 40 lakh people have died.
40
Okay.
lakhs.
Yes, yes. So it is a very, very large number, right? These are not small numbers. These are enormous numbers. I'm trying to say that there could be a conservative estimate, there could be a larger estimate. You could quibble about the estimate. But the point is that you should be accepting that a huge number of people have been wiped out in a very short amount of time. And this has left a scar on your society. Okay, people are scarred mentally. People have suffered losses. Almost every household in India knows somebody, friend or family member, who has died of COVID. And they are maybe died in very difficult circumstances, gasping for oxygen. Maybe they have not been able to provide oxygen. Your healthcare workers are in a crisis because they are working non-stop on COVID cases. Even now, when people are saying, "Oh, COVID has receded," ask the doctors and nurses; they are still working,
Yes, yes.
non-stop on those cases. And what they are, imagine what happens to a doctor or a healthcare worker who is not able to save a patient simply because they are unable to provide something as simple as oxygen. So you have the technology for it, but you are not able to provide something as simple as that to your patient to save their lives. Okay. And this has happened in cities like Delhi, but it has also happened, of course, on a far larger scale in rural India, right? Rural and semi-urban India, especially in the North Indian states. And I think that this is something which we need to, why do we need to even think about this, right? I think that the point is that these numbers, the government is so quick to deny the numbers. And
Okay.
my question to
why do they manipulate this? Why do they undercount the death? What is the purpose of that?
I think primarily it is politics, because basically to admit to deaths is to admit to to admit to being fallible, to admit that you have made a mistake, to admit that you may be responsible for a large
Inefficient.
number of deaths. No, more than inefficient. See, the point is, it is not just inefficiency. If you look at it in terms of accountability, see, the government knew that the second wave was coming. It was not that they did not know. They did know. They were informed. They did know. But what they did not do, you see, the lockdown period last year was obviously mismanaged horribly. But even if you did impose a lockdown, you should have used the lockdown period when there is a slowdown in the virus spread to basically provision for a time when the virus will again spread fast, right? So you should have put in place your oxygen requirements. You should have put in place your COVID management camps so that you, even in rural areas where oxygen is provided and people in distress can come, you should have done your communication to people about how important it is to mask up and all of that. And if you fall ill, don't worry, there's no stigma. Please come, please report. We'll make you well. You need not be scared. But that is not what the government did. What they did was, even at that time, was to hold elections in Bihar, hold elections after that in Bengal. No masks. Your leaders are going unmasked. Then they did not make any of these health provisions. They announced to the world that India has won a victory over Corona. They said this inside India and outside. And they said that, worst of all, they held the Kumbh Mela. Now, the point is, every time you say Kumbh Mela, what people, what the BJP's supporters tend to say is, oh, you are picking on Hindus and all of that. You're blaming Hindus. And I'm not. I'm saying that I'm blaming governments that killed Hindus. Okay. Because Kumbh Mela, some 90 lakh people attended the Kumbh Mela. Can you imagine that number? 90 lakh people attended. Your previous chief minister from the BJP said, please don't hold the Kumbh Mela because I think it will spread. Hold it in a symbolic way. Let some 10, 15 people come and finish. Okay, not more than 100 people. They sacked him because he was unwilling to hold the Kumbh Mela, and they advanced the Kumbh Mela by 1 year. Brought in a new chief minister who was willing to tell a lie to the world. They lied to people saying that Hindus cannot get affected by COVID. They invited devotees. Prime Minister Modi put out advertisements saying that it is clean and safe to come to Haridwar to attend the Kumbh. So come from all over India. They came. And not only that, in order to give a false reassurance to people, they basically hired a company which is run by a BJP man. And that company produced false COVID tests, lakhs of false COVID tests, which have now come to light. In order to tell a lie to the world and tell a lie to the devotees that you won't get coronavirus here. So basically, those who came innocently, not knowing what was happening. And they fell sick. They carried the sickness with them back home. And they have suffered the consequences. Of course, those who died then will be Hindu, Muslim, Sikh, Christian, whatever. But the point is that, this is a government that does politics in the name of Hindutva, that spread Islamophobia to hold the Kumbh Mela. They said, oh, Tablighi Jamaat was the real super spreader. You can never call a Hindu festival a super spreader. Now, that is Hindu supremacist nonsense. And it costs Hindu lives, apart from other lives. Okay. Right. So I think it is high time that this is understood, that the government is responsible. So of course they want to play down the numbers because they don't want to face up to this. They want people to still be ashamed of saying that somebody died of COVID in our family. So they are trying to spread a stigma about COVID. They are trying to deter people from approaching hospitals, deter people from taking vaccinations. There is anti-vaccination, anti-hospital campaign down below throughout, being run by right-wing elements also. And in these situations, basically, it is up to citizens then to say that those who died are, it is important. Each person is an individual who died, right? So counting
that's true, but I have a question here. Right. See, this is happening all over the world. The data, many countries, they are hiding the data. And do you find, besides this systemic failure, do you find any political design or conspiracy for hiding this data by the governments?
I think it depends on which governments we are talking about. Some of the governments I can see, I don't think that they are especially, the excess death numbers there are not that large. So several European countries, for instance, I don't think that they are actively hiding data. They are recognizing, they are themselves are recognizing that we are probably undercounting. So we should assume the numbers are somewhat higher. If you look at, prominent governments that have definitely tried to hide numbers, the Trump regime definitely did. Donald Trump, of course, said it openly. He said, if you don't test, you'll have less numbers. So, he at that time, when it was to do with COVID cases, so he tried to do all that. And he spread a lot of anti-COVID, COVID conspiracy theories and all of that. The thing is that even if you, for me, when I look at a country like Russia now, okay, and I see that the excess death count there is massive, and the regime there is a very authoritarian regime. It is very clear that they are doing exactly what India is doing. And basically, anybody who is trying to say that there are higher numbers of deaths is somebody who will probably face a jail sentence or be bumped off or something of that kind. Essentially, they are threatening people. They do not want the truth to come out. It's exactly like that in India also, especially in states like UP. But of course, the excess deaths are there in many states in the country. Among the South Indian states in Andhra Pradesh is very bad. And in North Indian states, there are several states that fall in that category, which I mentioned.
Yeah, you are telling about each and every individual's death at every home. And what is the significance? So many people have died, lakhs and lakhs, as you said, around 20 lakhs people might have gone. And they have become insignificant. They have been reduced to mere numbers only now. At this juncture, how can we signify their death? And you have promoted a kind of movement to mourn the deaths of people during this period. Please, could you please explain that?
I think behind that campaign, there were several impulses. Let me share one, and let me also talk about one condolence meeting which I attended yesterday as part of this campaign. So yesterday in Delhi, we attended, it started out to be every Sunday, but now, people are organizing it on other days also, and that's fine. We attended a meeting where in Delhi, in a place called Mustafabad, ASHA workers, they are these accredited social health activists. Okay, so basically they're government health workers who are ill-paid they're not paid any salary at all. They're paid some pittance of 33 rupees a day, which is nothing. The thing is that because they are frontline health workers who visit people's homes, okay, they are particularly vulnerable to COVID, right? And so these women had gathered, and they're all women. So these women had gathered yesterday, basically to remember their colleague, who was a woman called Noorma Naz, a young woman around, less than 40 years of age. She has left behind two children. One is a 17-year-old girl, and there are two younger boys, smaller boys, and her husband. And she fell sick to COVID and passed away. Now, the thing is that even I did not know, right? If at all, then we may have known, okay, one ASHA worker died who was associated with so-and-so dispensary in Mustafabad. If at all, you would have a number and that's it, right? You would one number, right? But the point is, if you actually visit the family, if you speak to these women, if you listen to these women speaking about their colleague, and you see the sorrow in their eyes, and you see them, they spoke to her on phone when she was, she didn't go to hospital. She was in her own house hoping to get better, but she died. So they spoke to her. They told us about how she was concerned about her patients right till the end. So she would pass on, WhatsApp messages about her patients saying, please follow up on this patient, follow up on that patient, be sure to take care of this patient, that patient. And what kind of person she was, how she enjoyed having fun, how she liked to plan for them to go off on a, picnic somewhere or something like that. All these things, you basically see that this is an entire human being who lived, whom people were friends with, people had quarrels with, people, she had children who loved her, she had a husband who loved her, she was an educated woman who wanted to educate her children further. All these things, it's a real life person, right? So the point is to remember that person is also to heal a little bit of yourself. So all those women are terribly traumatized by the death of their colleague. And she had had one dose of the vaccine. She died after that. So of course, they are also fearful for themselves, but also, so to talk, I think, has a healing element in it. That is what mourning does, right? That is why we have, all societies have ways of mourning their dead. And to mourn and be able to mourn without suppressing it is important. The other thing is also, I think, that why is it important? Each person who died was someone. It's also a way of, to talk about, people say, oh, why do you talk about death? It's all negative. Focus on life. That's what Mohan Bhagwat says, right? The point is, if you really want to invest in life, you have to be able to confront death. You have to face, you have to look death in the eye. If you are not going to do that, if you are going to pretend that people did not die, then how will you prepare for the future? How will you make sure that such deaths do not happen in the future? How will your government prepare? How will your society and your health systems prepare? So to say that these people died, and they died when they could have been saved, and in future we must never let this happen. This is something enormously important. One more thing I will say, that this is a government, let us not forget, just last year, which was telling us we are going to count every citizen and check their papers and find out who is a citizen, who is not. So every citizen was going to be asked to run around trying to prove that they are a citizen. Now, today, you are having a situation where citizens are having to go around trying to prove that they are a citizen, because the government wants to pretend that this cops also was not a citizen. What absolute, insensitive, callous horror is this, that your government, your UP government will go and take the shrouds off, makeshift, shrouds that poor people, why have poor people buried bodies by the Ganga or let bodies go? Not because they did not love those people, but because they could not afford anything else. There was no space and they had no money. And basically they were forced to, do these things. So the point is that for your government to take the shrouds away so that the bodies cannot be seen, the burial sites cannot be seen from the air, cannot be photographed, cannot make an embarrassing photograph for you. I mean, that's sick, okay? That's absolutely sick. I would have expected any caring chief minister to actually go to the banks of the Ganga and say, Mea culpa, I'm sorry. I'm responsible for this. And I believe that this should not have happened. And, things should go better next time. So to not do that is really horrible. Yeah.
Okay. Besides that, how did, we'll come to the political economy side.
Right.
How did the pandemic help the big corporates to flourish? Despite this COVID pandemic, corporates are earning big money. I have seen the data and all. And especially the medicine, in the field of medicine, and they are able to mint crores and crores of money. How do you connect this COVID management or mismanagement with capitalism?
See, if COVID has taught us one thing, I think it is the lesson that ordinary people should learn is that, earlier the idea that healthcare is a right for all and it should be available freely is something which used to be mocked at as something that, oh, this left people say and they don't really understand reality and it is not realistic to talk about free healthcare. Now, the point is that if you're going to have a privatized healthcare system, which is profit-based primarily, and which says that, okay, for some poor people, we will make some budgeting, we'll give you insurance or we'll do something, but we will essentially have a system that works on the basis of profit for large corporations. Then you basically have a system that cannot cope with something like an epidemic, like a pandemic, okay, or even an epidemic. Why? Because you see, epidemics are not individual-based. Epidemics spread. There are causes for their spread. You have to map their spread. You have to have a public health policy, basically, right? And we have been saying this about other epidemics in India for years, for decades. Healthcare experts have been saying that even if you have an epidemic like, say, take dengue or take what's it called, encephalitis. Okay, so these, that they are seasonal epidemics that you expect them to come. So since you can expect them, you should have ways of mapping and predicting them. You should have a public healthcare system that is not just based on hospitals. It should be based on ensuring that people have enough nutrition so that they have immunity. Oh. You should ensure that they have good hygienic facilities so that they are not exposed to mosquitoes. The works, you have to have work, you have to have housing. So it has to be a public healthcare policy is not focused just on a hospital bed alone, right? For whether you can pay for it or whether you will get insurance for it after you pay for it. Okay. So the point is, you need, for epidemics, you need a public health care system, number one. Number two, the thing is that COVID is such a thing, and any epidemic is such a thing, that you are only as safe as the poorest and most vulnerable person in your society is safe. You can't say that, oh, let my sanitation worker be exposed and die. I will remain safe. No, you won't, Even a former ambassador in Delhi, poor man, he died gasping for breath, waiting for a hospital bed in vain in Delhi, right? On a parking lot outside a big hospital. Yes. So the point is that class also cannot keep everyone safe. It cannot, the virus will not respect your gated community, right? So the idea is that if you want to keep everyone safe, you really have to keep everyone safe. You cannot have a system that pretends that I will keep some people safe, because it won't even do that. So the point is, then you need a public healthcare system, and you need, as you say, these profit mongers. See, they are not invested in that at all, and they are wanting business to go on as usual. And it will, unless we stop it, unless we fight for a system of public healthcare saying, we don't want you to be spending on other kinds of nonsense. Please don't write off corporate loans. Rather, don't write off corporate debt. Take those, don't write off corporate tax also. Take those taxes, take back what the corporates owe us and spend on people. Then, of course, you can afford healthcare for all. And if you can't afford, in India, I think we also need to tell our rulers, if you cannot afford to have even a district hospital that is equipped with basic life-saving provisions for any circumstance and situation. Okay.
So you are suggesting a paradigm shift, a kind of paradigm shift you are suggesting in the healthcare.
And don't talk, and I'm saying don't talk about bullet train and, God knows what all. Okay, your healthcare system is not in the 20th century in India.
Right. Okay. If that is so, now they are running behind this vaccination drive.
Just one last thing I want to say on the last count, which is that, of course, also the fact that your frontline workers, now we know who are the essential workers, sanitation workers, nurses, doctors, healthcare professionals who are these ASHA workers and all these workers. Why are they so ill paid? Why are they so vulnerable? Why are they not the people who are the most protected in our society and the most respected in our society? So we have to correct this also, because it is the capitalist system that pays these people, that treats these people's lives as dispensable. And since these are the lifesavers, the grocery store workers, okay, they are the lifesavers, no? So if they are the lifesavers, please treat them with, let them have salaries, salaried jobs that are dignified jobs and all the safety that you can get, right? Yeah.
So now coming to this vaccination drive, because government is making a tall claim on this. How do you see this drive? Do you think it is a kind of a successful one, or do you appreciate this or not?
See, the first thing is that I do believe that the vaccinations are very important. We should remember that these are very unusual circumstances. In most other cases, like your polio vaccine or smallpox vaccine or something, these were developed over a long period of time. Now you're having a situation where vaccines are having to be developed in a very short period of time for this virus. And okay, these vaccines are being developed. I believe that vaccination should be done. But my question is that had the government done the vaccination in January, which many countries around the world were doing, even countries in South Asia were starting to do. But our country basically started thinking about buying vaccines sometime in January. Okay, so that is unforgivable delay. Okay, it's like this cartoon which this Hindi cartoonist made, where he showed a man, healthy man, saying, "I want a vaccine." In the next photo, it is a sick man saying, "I want the vaccine." And then it is a man on with a mask and in a hospital bed saying vaccine. And then the next, the Prime Minister is offering him the vaccine, but he has become a photo on the wall with a mala tied around it, with the flowers on the wall. So you have brought the vaccines very late, first of all. So for one thing, you cannot pretend that this is, a great thing. Second, India is probably one of the only countries in the world where the vaccine is being sold. Okay, so the vaccine was being monetized, sold, rather than given free. In any country, even in India, remember your polio vaccinations. Did you pay for polio vaccinations? Of course you didn't. You gave vaccination, and this is a party, BJP, which in election campaigns would promise free vaccinations to states that voted for BJP, that if you vote for us, I'll give you free vaccine. So that's completely horrible, okay? And the point is that vaccination should be free because it's a public good. The more people you vaccinate, the more your society will be safe. So you should not, is not, again, you have your paradigm completely upside down. If you think individuals should pay to vaccinate themselves, this is not just about their being safe. It's about everybody being safe, and everybody can be safe only when you have actually vaccinated at least 90% of your population, okay? So why has that not happened? Because you monetized it. People paid anything between 7,000 rupees to 4,000 rupees for vaccinations, right? They're still paying. That's number one. Number two, even the so-called free vaccination drive that began from the center. Initially, the whole thing was left to the states. States were told, you negotiate with the private companies and you buy the vaccine and you decide the rates and this and that, right? So basically, the central government started taking vaccinations under its control only when the Supreme Court basically told it off, right? Secondly, they tried to time, they tried to time it so that the first day that the Supreme Court, they wanted, again, a political talking point. So they wanted that on 21st of June, when the centralized vaccination starts, they should have some record number, which all media will talk about, so that, oh, Modi ji finally has everything under control. But the point is that how did you manage to have, you are making only, say, 50, 60, lakh vaccines a day. how are you vaccinating 93 lakh vaccine, 90 lakh vaccines in one day? The only way that you can say that is happening is because you're hoarding. So you basically ask BJP ruled states to hoard the vaccinations, to hold back the vaccinations, and then vaccinate together on 21st, so that you can show this magic number that I vaccinated around 86 lakh people. Now that is criminal, because the sooner you vaccinate, the lives you're saving. This government is not invested at all in saving lives. It's invested only in optics and making itself look good. And in order to make itself look good, it's willing to shove bodies under the carpet. It is willing to do testing scams. It is willing to basically lie about vaccinations. And all these things. It is willing to hoard vaccinations. It is playing with our lives, even today, even now.
Yeah, it is so. What kind of plans your party is now putting forth to face this kind of political situation?
Right. So what we have started doing very seriously, for instance, I'll tell you, of course, we have started doing it in other states also, but I'll tell you our experience of Bihar, where it is underway with quite a lot of seriousness now, this campaign. So the first thing is that there are teams of our comrades that are going, into villages door to door, basically trying to identify COVID deaths or possible COVID deaths, or even non-COVID deaths that have happened in an unusual circumstance, avoidable circumstance now. And this is an important exercise, we realize, because people are suffering from a lot of stigma. So they have lost a family member, a much loved family member, maybe an earning family member on which everyone was dependent. But they have not been able to talk about that loss. Why? Because there is a circumstance where if you died of COVID, there's a stigma. So, you lie about it. You say he died of heart attack, he died of something else. Okay. So basically, even creating the circumstances where people say that, yes, he actually had these symptoms, of cold and fever and cough and all of that. And then he had breathlessness and he died, or she died, right? To be able to even say this and to realize that you're not alone, that people will not discard you and ostracize you when you say this. Rather, you will be part of a larger community which is hurting, which is in pain. Then you mourn. And you also see that then I deserve, the family members deserve compensation. Compensation is not compensation for the life that was gone. Compensation is an admission on part of the state that they that they are responsible, that they bear responsibility for this death, and that they are therefore they owe something to the family members of the person who died, right? You can never get that person back whom you loved, but at least you can. So even filing for compensation, even demanding compensation, saying that please do not demand a COVID certificate. You did not test in villages. So how are you demanding a COVID certificate there? All of this we are doing. Number two, we have started a healthcare campaign, basically saying that a healthy Bihar is everybody's right. And so first, we have started this in the constituencies which we contested in the assembly election in Bihar. So we had contested 19 constituencies, we won 12 of them. So we have started the campaign with the 19 constituencies, basically trying to map out what are the healthcare services that the government claims on paper exist, and contrasting it with a detailed report about what actually exists. And having doctors and healthcare professionals say that, look, we are working here. We are trying to save lives, but what we need, we do not have. We are short of this, short of this, short of this, short of this. So that in detail we are putting out, and we want this campaign to be a campaign which is not just a political campaign by a particular party, but something in which anybody who is concerned about health should join. So anybody who is, so a lot of healthcare professionals are also joining it. A lot of sanitation and healthcare workers are joining it. And ordinary people who basically are saying that, healthcare as a right is something I should not have to die because I could not go to hospital, or because the hospital did not have oxygen, or because the hospital did not have a bed, right? So all these things, as well as the rights of the healthcare workers. So someone like an ASHA worker, what should her rights be? because she is providing such an important service even in such dangerous times at the risk to her life. What should her rights be? All these things we are raising as part of this campaign. And we are planning that this campaign should go on intensively in the month of July also. In fact, I myself am planning to go to Bihar and spend some time with the campaign to see it closely and see what I can do to help the campaign also. Yeah.
Hope this kind of this model will be very helpful to our friends, comrades also in Tamil Nadu. Thank you so much, Kavitha, for sparing your wonderful time, and I think definitely this would benefit our audience. Thank you very much. Thank you so much.
My pleasure.